It's lovely to be presenting with all of you today. Great to learn about everybody's research and good attendance here, which is wonderful. So I'm a professor in the School of Nursing, and my research is focused primarily on dementia and on caregiving, and I do community-based research that aims to really transform and change the ways in which we view dementia. There's a lot of stigma attached to it. So I thought I'd talk today, just give you an overview of how my research fits into an overall program that I'm working to develop and pretty committed to. My dad had dementia for 17 years, and I saw how empty his life was, and it shouldn't have to be that way. So just as an overview, I'll talk a little bit about Dementia Inclusive Victoria and what I mean by that. And then I'll talk a bit about some of the programs that I've been working to develop along with colleagues that are moving us towards a more inclusive Victoria. And then going forward, a couple of the things that I'm currently working on. So let me begin by talking, most of you probably know this, but there's over nearly 500,000 Canadians currently living with dementia. These numbers will nearly double in the next 9 years. And at present, there's no medical cure, and it's not expected soon. And people with dementia often face a lot of stigma and social isolation. There are a lot of losses that come with dementia, and people are afraid to tell other people they have memory loss because they find they get treated differently. They aren't included. People assume that they can't contribute. This has high impacts on health and quality of life. Social isolation is worse than smoking 15 cigarettes a day. It's worse than being overweight. It increases your risk for mortality. So we know that, that it really has important impacts that need to be addressed. Given that there isn't a medical cure and that pharmaceutical treatment basically just helps you function a little bit better for maybe a year or two, and you could live like my dad, 17 years with dementia. What we need, I think, are approaches that foster social connections and that allow people with dementia to participate in a meaningful way in activities that are inclusive, that accommodate, and that allow them to contribute, ideally as equals, towards some key outcomes. So Dementia Inclusive Victoria was inspired by what I saw happening over in Seattle. There was a project called Dementia Seattle. And basically it is a way of including people. It's a way of providing organizations with a sense of how easily they can accommodate dementia and bring people into the community in a way that allows them to participate and to engage as citizens. So our goal with my Dementia Inclusive Victoria planning project, which was funded by the BC Support Unit through CIHR, was basically to map dementia inclusive programs and activities in Victoria and to identify any organizations that needed support to help them begin to think about offering dementia inclusive activities, and to explore the impact, the focus of the Dementia Friendly Communities Initiative by the Alzheimer's Society of BC, and to begin to write an implementation grant to develop kind of a grassroots collaboration among organizations that wanted to be part of dementia inclusive programming. Now, I looked into the Dementia Friendly Communities Initiative by the Alzheimer's Society of BC. They funded a number of projects like in Burnaby and in North Vancouver. And if you search for Dementia Friendly Communities BC, you'll find some of these projects. The focus of most of these projects is primarily on making sure that police know what to do, if they encounter someone with memory loss, that, firemen are trained in dementia, that postmen are trained, that, different, these different, agencies that provide public services, banks and whatnot, all have an understanding of dementia, which is a important and good thing to be doing. My focus with Dementia Inclusive Victoria, though, is really more to find ways to bring people into meaningful leisure and recreational and kind of arts-based activities that are meaningful and that they can participate in. It's not about training, it's about making organizations more dementia friendly, dementia inclusive, but it's not about training firemen or policemen or any of that. What we found in looking at Victoria is that there aren't many dementia inclusive programs. In fact, there's very few. Whoops, I thought I had one more slide there. There's very few dementia inclusive programs. In fact, there wasn't even a memory cafe, which there's memory cafes all over the world that provide primarily a bit of social opportunity to meet other people who have memory loss, and a bit of education, and a little bit of light entertainment, I would say, like some singing or someone entertaining. So there's no memory cafe in Victoria. I was involved with a group of people. I proposed starting a choir, and we called this choir Voices in Motion. Voices in Motion was inspired because I had a colleague who started a dementia-friendly choir in Minneapolis called Giving Voice. Their choir was so joyful and provided a place for both the person with dementia and their care partner, dyads in other words. This isn't a program that was focused just on someone with dementia, but the dyad to come to a choir, a professionally led choir where people sing in sections. It's not a sing-along, where they learn new songs, where they are asked to perform at a high level, to do hand motions with songs that require moving around, to learn songs in other languages like French or African songs. So the Voices in Motion choir was inspired by that. And what I kind of brought to it was I wanted it to be intergenerational. I thought it was really important to bring young people in high schools or younger age groups into a choir to not only provide support, but also opportunities for intergenerational understanding to expand, for young people to learn about dementia and not be afraid of it, for them to see older adults in general as much like themselves or their parents in terms of wanting to have a good time, having things to share. And also the young people provided some support and brought a lot of good energy and some lovely voices too to the choir. So Voices in Motion, it's professionally conducted by Erica Fairberg, and we now have 3 community-based choirs that are meeting in person in the community. They're singing with masks. They met online all through COVID and sang on Zoom, which is not the ideal platform because you can't hear other people. And we have 1 online choir currently. So the choir started initially as a research project that was funded by the Alzheimer's Society, looking at the benefits of participating in a choir, particularly on cognition and wellness and quality of life. Not much research had been really done. People could see the benefits of choirs because there were several in the United States at that point, and there's now over, I think there's about 50 or 60. And we had a few here in Canada, a few dementia choirs, but they weren't intergenerational, and no one was doing research. It just seemed like obvious that, people were benefiting from this. So we were fortunate to get 2 years of funding to do this project, and it was a mixed method study that for a year and a half, we ran people through 2 seasons of the choirs. We started the first season with 1 choir and then expanded to 2 choirs the next season. And our findings, you'll be hearing about some of them following my talk today from Cindy McDowell, who's been working with that data, and the findings have been incredibly impactful. So this choir continues. It became a nonprofit. It's recently become a charity, and I'm so glad it's sustainable because often we start research and when the funding is gone, we leave people with very little to hang on to. The choir's formed a community of support. People really enjoy it. A few of the findings here: it does improve cognitive function, which Cindy will talk about in more detail. We found that it increased the quality of life. It decreased distress for caregivers. It helped reduce anxiety and reduce stigma, particularly stigma that students had about dementia, and brought a whole heap of positive emotions, memories. People would sing songs like The White Cliffs of Dover, and it would bring back memories of World War II that they could then share. So they were able to contribute in an equal way. And before COVID, we used to have a concert at the end of every choir season, which was 12 weeks long, met weekly to rehearse. And people in the audience couldn't necessarily tell often who had dementia. I mean, they would see this choir, which had lovely voices up there singing, and be pretty amazed. And I'm gonna share with you just a quick little excerpt here. and I'm hoping you can hear it. Just to give you a sense of this.
If you ever find yourself stuck in the middle of the sea, I'll sail the world to find you. If you ever find yourself lost in the dark and you can't see, I'll be the light to guide you. We find out what we're made of, when we are called to help our friends in need. You can come, I'll be there, and I will wait like you and count on you. I will be you'll be there, 'cause that's what friends are supposed to do. Oh yeah.
Okay. Hang on. Oops. Let me return. Okay, there we go. So that gives you a sense of what the choir is about. You can see that the young people have a really good time and they dance, and it's been an amazing experience, and I'm so glad it continues. So that's one of the legs, I think, of a dementia inclusive Victoria, is having community choirs like this available. Another project I've been working on for the last year with Sanjeet Roy, who is here today. He's a doctoral student in the SDH program, and I want to thank him for his work on this project, is the Memory Cafe Victoria, which was conceived of as a joyful and creative space for people to gather, and we wanted to offer a high quality arts program that had meaningful activities that involved learning for people with dementia and, again, their caregivers, because we thought it was important to have caregivers involved and having fun as well with their partner, and changing the focus from just providing support to actually interacting and participating as well. The whole purpose of the Memory Cafe is to foster social connections and creative engagement through activities that are meaningful. Okay, the structure of the Memory Cafe, it's a weekly online program. It's now in its second season. The first season we met completely online on Zoom for 1 hour, about 1 hour a week. We had to limit the number of people that could participate because really you can only have about 9 or 10 screens for people with dementia, or it gets a little confusing. And it's also hard to create a sense of community with a larger group of people. Again, the sessions were professionally led, and we had sessions on poetry, the Alzheimer's Poetry Project, drumming, music, story creation, some art creation involving making masks, and a few other things. And we had some intergenerational student volunteers who were wonderful, and participated and provided support, like mailing out art supplies and helping facilitate some sessions. So the Memory Cafe, just to share with you a few quotes, some of the things that came out were around social connections, that people wanted to get to know one another, that they felt that that was important, that people enjoyed being in the moment, that even this one participant who had fairly advanced dementia, although she didn't remember what happened afterwards, in the moment, it was like she was her old self. So her caregiver liked seeing her like that again. From the students, I just love this quote. One of the students that participated said, "I love getting to hear about participants' weeks and hearing about their various interests. They have vibrant personalities. I feel as though a lot of individuals in my generation don't recognize this enough. They often assume all elderly individuals are the same and that they have boring hobbies and stories. But what I love about the Memory Cafe is I'm reminded of how untrue that is. I'm reminded all these individuals are uniquely human. They have stories to share, a sense of humor, people they've loved and lost, and remembering this, in my opinion, is of vital importance when connecting with people." So just to give you a sense, the student volunteers, what was great about having them was they would create like a little flyer, a poster of some of the activities. So this was a music creation activity we did. And the students would capture the comments of the people participating and then create this little poster that we would send out to all the participants to remind them of, what they had experienced the week before. And so here you can see some of the comments. Welcome the music child. This was an activity where it was some music expression, it was some movement expression combined with some masks that we all made. So the previous few weeks previously, we had sent out masks and people created masks to represent something, whatever they wanted to do. And we gave them examples and we gave them some supplies. And these masks are hilarious, I think. And then we were led by Kairos Alive, which does some expressive movements, and everybody got to wear their masks. And we had a little bit of a dance party with live music. Vladimir's down at the bottom left there. And he's from, I think it was Brazil, and just an amazing musician. Okay, and what people had to say about the mask. Here's just another example of the poster. We asked them, if your mask had a superpower, what would it do? And people talked about visiting family, getting rid of Alzheimer's, ending the lockdown, etc. So you get a little sense of just the ways in which we brought a lot of creativity into the Memory Cafe and helped people connect with one another and get to know each other. When the Memory Cafe ended, people were really sad. It happened last spring, and I was trying to, it was going to be until fall before we would get together again. So we had a picnic in the summer, and we met at a local park, Willows Beach, and I thought people would leave after a couple hours, and they stayed all afternoon playing croquet, eating sandwiches that everybody brought their own picnic, and just kind of getting to see each other for the first time in person instead of on a screen. Going forward, I can't see my time. I should look. Yeah, I think I'm doing okay. Going forward, I've got two projects I'm working on currently. One is a proposal I'm writing for RX Connect, which is about social prescribing for people specifically with dementia. Social prescribing is being done more. There's a lot of interest in it, especially in the UK. It's really taken on. It's been adopted in Ontario, a bit in Quebec. And here in BC, United Way has done some social prescribing. I'm thinking of it in a very different way because nobody has focused on people with dementia. And we now have a primary care memory clinic. And I've been working with Dr. Andre Bargava and Dr. Malone and I have their support to provide social referrals to 3 dementia-inclusive community-based programs. One would be a fitness program, the Minds in Motion, offered by the Alzheimer's Society. One would be the Dementia Choir, the Voices in Motion that I mentioned. And the third would be the Memory Cafe. And so we would be able to look at the impact of referrals to programs on key outcomes, compare key outcomes, and also look at the implementation process and whether that really worked, referring through a memory clinic. The second project I'm working on is this idea of Momentia Victoria, which is funded by the Vancouver Foundation. And it's this website that will provide recreational and arts activities and programs that are more dementia inclusive. For example, Saanich has a gentle walking program that would be perfectly appropriate for people with dementia and their care partners. And I don't think it's widely known or thought about, along with the other programs that I just mentioned. So we've developed a small coalition of local organizations, and the RBC Museum has someone who's helping us with a program for people living with dementia, and the local art gallery here in downtown is also developing a program for us that we're offering on Thursday to our participants. And again, all of these programs will be involving dyads. So, whoops. Okay, so I just want to acknowledge all the other members on this team because it really does take a village. And so on the left, kind of key leadership roles, and on the right, some of the student volunteers that have been involved. And then all the funders, because the projects were all funded by different groups of people. Okay, I think that's it. I hope I fit into my timeline pretty well. Thank you, Ashley.
Thank you, Deborah. Perfect timing.